How many of you would agree with the statement, healthcare is in crisis? Absolutely. How many of you tried to get an appointment with a provider for a physical? Are you pushed out 2-3 years? If you're trying to get an appointment with a provider for something urgent, are you talking about 2 or 3 months? That's unacceptable. And healthcare is definitely in a crisis. So we also know that healthcare is surrounded by illness care. It really focuses on having a problem, and that's when you enter the system, and that's when all the fun begins. That's when all the procedures happen, the lab work, the access to care, the costs go up and up and up. So as long as you are having issues, that's how the system makes money. But the shift is really going to value. Like, how can we keep people healthy? So the illness model is that transaction model. The value-based model is the wellness model. It's the model that looks at a longitudinal relationship with a patient. So we follow their journey, their healthcare journey. And the goal of it is to try to intervene sooner in the process by identifying illnesses early, preventing them altogether, or if they do already have an illness, how can we keep them to their optimum level of wellness? Out of the hospital, out of the ER, out of urgent care, that's where the costs are so expensive. And we've all been there. All of us have been impacted by this. And that is me diving off the healthcare cliff. No. Absolutely, we're the solution to the healthcare issue. The National Nurse Practitioner Entrepreneur Network was really forged because we felt that nurse practitioners and PAs and physicians, for that matter, get zero business education. Yet we're supposed to go out and open up practices not having a clue what the first thing to do. And some have done successfully well. Others have failed miserably. But the problem right now is we need all hands on deck. There is a shortage of providers, so we really need to make sure that all of us can practice to the top of our license, we get rid of the regulatory barriers, and that we help support NPs that want to start their own practice. So that's where we came about. And we started with just an office hours. The third Tuesday of every month, we hosted a webinar, and it was a hot topic. So it might be on insurance, a business startup, it might be on billing and coding, it could be on insurance, it could be EHR, and all of those really started to create this community. And from that, we've built our business. So NNPEN is helping to change the directory of healthcare, the trajectory from that illness model to the wellness model. And the way we do that is helping nurse practitioners start their practices. So what are about NPs and why are we different? Again, we're focused on that whole person care. We look at somebody not only as heartburn, but what kind of food are you eating? What's your stress level? Do you take a lot of ibuprofen? Do you drink a lot of alcohol? Do you eat late at night? What are some of the other things that can happen? And if you get a medication, for example, can you afford to buy the medication? So the plan of care is really around what's best for that patient at that moment in time. And that's how NPs operate. So we're definitely operating in that patient-focused model. We're the fastest growing profession. There's not enough physicians to handle the demand right now. Even though they'll say we're going to open up slots in medical schools for primary care and mental health, they're never going to meet the demands. Nurse practitioners can. We're 461,000 NPs right now, and we're growing exponentially year over year. So we are the workforce that can help ease that gap and fill those gaps in care. We're trained in health and wellness, like I said, so we do also go where the patients are. So we're not necessarily in brick and mortar, but we're going to people's homes. And it's a privilege to be invited in somebody's home. But while we're in there, do they have food in the fridge? Do they have rugs on the floor that they can slip and fall? Do they have 20 cats running around? What other things are impacting that person's sense of well-being? Have they not seen somebody in 6 months or a year? Nobody's come to visit them. You're the first person that they've seen in a long time. So, and loneliness is one of the biggest things the elderly have to deal with. So if we're able to go see them, now we're creating a community for them, and they're really feeling valued. The other thing is we do teach. We educate our patients. What do you need to do to stay healthy and well? So it's not just, here's the pill, or here's the treatment. Like, how we do that, explaining it, looking at it from the lens of the patient, and really getting them to understand how they can participate in their care. And again, that value-based model that is shifting the narrative from transaction to longitudinal care. And that over time, you develop that relationship, it has value. So why are NPs not starting practices? Well, first of all, again, we get zero business education. Even today, despite us being involved since 2017, there's still a lack of business training. It is improving. I have to say, we were able to participate with Washington State University recently. They had received an endowment from a generous donor to really focus on nurses in business. And so they recognized us as a network and said, let's call them and see how they can help us. So we went and met with them. I did an entrepreneur seminar with them. And then we decided that this money could go to good use. We actually had 2 students attend our conference in Tampa, and Dan was fortunate to come there and present as well. We were happy to have him there. And they had 2 students. We had them do session monitoring for the rooms, so they got to hear all the speakers, and they got to participate. They had a one-on-one interview with me for an hour. They could pick my brain about any topic. And then after the conference, they went back home. And they sent letters of support to the vendor, the donor, and he was overwhelmingly pleased with the way this all worked out. And so I had a meeting yesterday with them, and from that, they're going to double the number of students they're going to have come to our conference next year. So we're going to have 4 students, so that's going to help us too with getting the exposure out. They are also going to pay NNPEN membership for all of their MP students. That's 180 students. And we're going to keep that going year over year until they graduate. Plus, we're going to do a program, first-year students, and these 2 students were first year. So I thought, that would be interesting to get their perspective being first-year students. But if we plant the seed then and foster that business education, guess what? By the time they graduate, they might really go out and just start their own business. So that's very exciting. So we're going to do first-year and third-year lectures for them as well on entrepreneurship. And from that, we also had the opportunity to work with another college who had an endowment, and I presented this proposal. And so I'm going to be meeting with them. So legacy-wise, I think this is a great way to infuse business into nurse practitioner education, plant those seeds, and then keep that process going. We don't understand business speak. KPI, what is that? What does that mean? I mean, we know outcomes, but we don't know what a KPI is. And then all the language that goes around understanding business, it's foreign to us. We build our practices in isolation. So we have a good idea, we go out in the community, we start a business. And again, because we don't know what we don't know, it might be successful or it might fail. We just don't know. And again, getting that exposure. None of these nurse practitioners are visible now. They're flying under the radar, doing great work, but we have to get them out into the open and show them what they're doing and create that community so that they don't feel that they're doing this in isolation. The other thing is healthcare is changing so fast. And if you're not connected with a group that can actually keep that education, that information up, you're going to be missing out. Failure to develop a business model canvas. What is that? None of the students that I've seen or nurse practitioners that come in have even developed a business plan, let alone a business canvas. And that's really a problem. So we established a business basics course surrounded around developing your business plan and business model canvas so that they actually have the tools in front of them when they finish our course to go out, get some revenue, start their businesses. Limited access to capital. Any physician can go into any bank and they're going to get money. It's a proven fact. Nurse practitioners, we go in and they're like, who are you? You want money? No, we're not going to give it to you. It is changing though. The community banks are paying attention to us because we're in the communities, we're making changes in the communities, and that has value, an economic value. And then these community banks also do supportive networking events that nurse practitioners can be part of that can elevate their exposure. So it really becomes a great opportunity. The Small Business Administration has been very good as far as providing SBA loans. So it really is important. One of the lectures we had at our conference this past April was on how to apply for a loan and business loan and how you do that. So somebody actually walked us through that process. It was great. Many are straddling that employee entrepreneur line. You know, they're just not ready to break away from their current employer. Maybe they need health insurance or other things are happening, and they're building their businesses in a shorter, short process, or trying to ramp it up slowly. We do see a lot of that, and that's actually fine because a lot of the MPs start with telehealth or house calls or going into the patient's home. Those are ways that they can actually get access to patients without a lot of startup costs. And solopreneurs. All of these nurse practitioners are solopreneurs, but what happens is we're finding that the BBA course attendees, and by the way, our success rate is 80% start their businesses, so we have a good track record. The concern, though, is that once they start their businesses, the demand is overwhelming, and all of a sudden they have to scale quickly, and they're like, oh my gosh, I don't know what to do. This is very overwhelming. So again, we're trying to do that mentorship and hand-holding and getting them with people who can pace them in their growth so that they can be more successful and stay in business. The last thing we want is for them to close their doors. So NNPEN, over the past several years especially, have really introduced more benefits to our members so that we can actually help support them in a greater way. Several things that we do is our Business Basics Accelerator course. It's 12 weeks online. We have consulting services as well. We have access to the monthly office hours. I had told you we do that recording. Those are the things that we started early on. We have a whole library of resource material. And we have partners with folks who understand nurse practitioners. Collaborating physician matching is really important because a lot of states, even though during the pandemic we had free rein to move about the cabin, provide care wherever care was needed, once the pandemic was done, those barriers went back up. Why? I have no idea, but they're there. And it's interesting because there are a lot more forces trying to stifle our practice growth because we are adding new practices day by day, and we really need to make sure that we continue to do that because we have to solve the healthcare crisis. But then there's regulatory barriers that keep going up or keep changing, so we have to stay on top of that as well. We partner with a lot of companies that understand nurse practitioners, that were in the wellness space, the prevention, that whole person care. There's so many companies that we've dealt with in the past that want to help somebody start up their business, but what they'll do is they'll create a mini medical practice and put an NP at the helm. And that's a recipe for failure because, again, they're going to be in that transactional mode, not that longitudinal care. When an NP sees a patient, 30 minutes, an hour, or more they might spend with you. But because there are billable codes and things that we can do with our patients, that adds value. The other thing is Medicare and Medicaid is not going to pay our bills. We get 15% less reimbursement than physicians from the get-go. So again, we're starting in a deficit, but we have to pay the same for gauze pads, for rent, and all the things to run our business. So unfortunately, we still have to do a cash service line added in so that we can stay solvent. So what are those cash flows? We work with the providers to figure out what's best for their community. We do have health insurance, which is very interesting. We have a broker in New York who does small businesses, and it's been you can get a la carte, and it's for the provider, their family, and their staff. So that's been very, very beneficial. And then we do a conference, like I say, every year. It's business focused, so it's not like your traditional healthcare conference where you're lectured on a disease state. Our conferences are interactive, and Dan can attest to the excitement and enthusiasm of the presentations. Brian Dennis gave an excellent presentation on AI, and I'm still hearing today how people are very proud and honored that they were able to hear him talk about AI because they learned so much that they didn't know. And maybe they're a little less fearful about how technology can actually help. And speaking of technology, because we're NPs, the general population out there is paying attention. Software developers are coming to us saying, you have NPs, we want to test out our software with you. We just did a focus group with an AI scribe, and they could not say enough positive about the feedback these NPs gave about their products so that they were able to adjust, pivot, and change their product to meet the needs of the NPs. We have mentorship beyond the classroom. We have discussion boards. The other thing that we're actually integrating into our member benefits is we have a meeting actually tonight that I'm signing the papers with the Nurse Attorneys Association. So we're going to have a hot button for NPs. If they have a legal question or concern, they can hit that button, fill out a form. It goes to the nurse attorneys. They'll look at it. They'll say, hey, we have somebody in our organization that can do that, or I don't know anybody that does that, but we'll hook you up with an attorney in your state that can take care of that. So that way, they'll get the legal expertise that they need quickly and efficiently. We are also going to do, based on our conference, we had a session called Blurred Lines, where mental health providers and primary care providers were sitting around a table, and what became a discussion focused on patients who potentially have psychiatric conditions like schizophrenia, and they get discharged, and then they go see the primary care first because their psychiatric mental health appointment isn't till 6 months down the road. You got this patient who's on a drug you don't know anything about, and you have to refill it, or otherwise they run the risk of being readmitted. So this button could be pushed. Your information can be filled out, goes to the psych NP. She can actually have a conversation with that nurse practitioner. This is the medication, this is the dose, that's the correct dose. These are the things you have to monitor while the patient is on it. Giving that NP more confidence to refill that medication and knowing somebody's there if I need them. And the response rate is going to be within 48 hours. I just went to a seminar last week on trust building with Brigadier General Mark Town. It was phenomenal. And I did meet pharmacists, and I'm just thinking, couldn't we have a pharmacy button on our website? So again, I talked to them. So we're in the process of developing that same model with pharmacy so that we can ask questions if we have a question. So I think all of those things are value add for our members. Yep. So the other thing that we developed is a directory because we know these nurse practitioners are doing great work. We just don't know where they are. So we developed the NP directory where patients can find a nurse practitioners can find each other for collaboration, support, resources, referrals, and then students can find preceptors because believe it or not, preceptors are at a premium, and many want to partner with a nurse practitioner, and then these nurse practitioner students could actually become employed by the practice at the end. So there's a succession plan that's created as well. And these are pictures of all of our NPs that are currently on the platform. We started March of 25. We have over 600 NPs registered on the platform right now, which is great because now that's starting to get us a little bit more leverage. And to join this is free. It doesn't cost anything, but what we're going to do is add enhancement services. Those of folks that are registered on the directory, we're going to convert those to NNPEN members because of the additional benefits that they get. So hopefully the cycle of that will keep going. Next. So we made Destination NP a 501c3 purposefully because what is one thing nurses and nurse practitioners don't have access to? Capital, right? So because we're a 501c3, they can apply for a grant. So that community bank that has that $10,000 grant they dole out maybe every 6 months, that nurse practitioner could apply for that grant funding through Destination NP. We would take an administrative fee and then give them the money back into their practice. So they could hire new staff. They can buy a piece of equipment. They can take an education program. And that's what nurse practitioners will do. They'll infuse this money back into their business. But it's a pathway also for NP visibility. Again, getting those NPs in the spotlight is really important. And again, stakeholder engagement. Because we have nurse practitioners all over the country in different facets of NP care, people are starting to take notice. So for us, the future is just ahead. And I thank 1 Million Cups primarily for giving this opportunity to be out here and explain this. And seeing my growth over the last year and what we've been able to offer and the relationships that we created to improve access to care and improve patient care overall, because that's the mission of what nurses do. So thank you for your time, and I'll take any questions that you have. Yes?
So, congratulations.
Thank you
for coming back.
Thank you.
It's fun to see the story develop. I understand why you're doing this. But with this presentation, who is your intended audience? Are you looking to, would you, I'm representing us right now.
Yeah.
Thank you. But would you use this presentation for raising capital, talking with other nurses, explaining your service to clinicians? How should I view your presentation?
Depending on the audience, I tailor the presentation to meet the needs of who I'm speaking to. So if it's investors, there's going to be a lot more information on here about, how we, the growth of our organization, who's partnering with us, what our financial status looks like, all of that, for sure. If I'm presenting in front of our nurse practitioner conference, for example, I will probably drill it down to how can these benefit you as a clinician and a practice owner. So again, it's tailoring the program to who I'm speaking with. Yep.
So the business curriculum, 12 weeks. How many students have you have gone through that?
So right now we're at 72. We have 2 that are slated to graduate in 2 weeks. And so out of that, 80% started their businesses.
It's amazing. And how much do you charge for that 12? Can you tell? Or?
Sure. So it's $4,800 if you're not a member of NNPEN. It's $2,400 if you are. What it consists of is content during the week that the nurse practitioner can do during any point in time. It's PowerPoint presentations by content expert speakers, TED Talks, articles, and supportive workbook exercises. And then we meet on Zoom once a week so that those cohorts feel connected. And then they develop these relationships after the program happens. As a matter of fact, on Monday night, we had one of our presenters. She showed her folder that she designed with her logo and everything, and it was just really exciting to see, that this is being real. It's tangible. We can feel that it's happening. So we're excited about that.
And so basically, then the story that you had said is that alumni had donated money so students can become NNPEN members, and whatever that membership fee is and all that. And then now, because they're members, they then have access to entrepreneurial education.
Correct.
To actually start their business at a discounted rate.
Right.
Which is a very healthy figure because it's all online. Correct?
Right.
So 24 to 48. Thank you. Interesting. I'm going to take this back to my boss. Please.
Thank you. Well, and the other thing to consider too is that practice authority for nurse practitioners vary by state. So if you are in California, the rules to start a business are different than they are in Mississippi than they are in Connecticut. So we don't know all the answers, but we're connected to the resources and support folks that we can ask those questions. So again, trying to get the right information because a lot of NPs are out there saying, hey, I started this type of practice, med spa or whatever, and I'll teach you how I did it. But that's great if you're in the same state that they were, but if you're not in the same state, there could be a lot of challenges that you didn't, unintended consequences for not knowing. And then the other thing that we do with our business courses, we don't cut you off after the 12 weeks. You have access to that for life. So in the marketing mode, if somebody wants to go back and say, hey, what were they talking about in the marketing? How did they talk about SEO and all that? You can take that marketing class and look at it again.
Well, I was just going to, I'm sorry if I'm monopolizing this, but I was just going to suggest that you might want to even create a portal where they can upload their financials. It's a financial tracking mechanism. So there's a whole business portal that they can subscribe to that gives them those basic tools.
You're reading my mind. So one of the things that we've just done is we've partnered with a company who actually is helping to carry those first-year business owners through that first year. One of the things that we're creating with a consulting company is a financial dashboard so that they can go in, assess your financial dashboard, look at your payer mix and say, hey, these are areas you can tweak, this isn't working well, you need to pivot and all of that. So that's another enhancement that we're working on to bring in because that is a pain point. We don't understand our financials, we don't know what's going to work, whether it be profitable or not, and that solopreneur is doing everything. Chief cook, bottle washer, they don't have time sometimes to think about some of this, but that's so important for your business. Yeah, thanks.
Yeah, you kind of scratched the surface of my question. And so you mentioned that there's a little bit of education on the front end, right? And then there's obviously a lot of support on the back end, but with each state having different requirements, right? Like in Connecticut, correct me if I'm wrong, you have to work under a physician for 3 years before you can even start your practice, right? So before you can
No, you can start your practice anytime. Okay. You just have to have this collaborative agreement for the first 2,000 hours and 3 years of practice, right, which you will pay for.
So are you, when you're in that phase, are you working underneath a practicing physician? Are you
Absolutely, I appreciate that. So we're licensed independent providers. We're the only profession that's overseen by another profession. Nobody else is. The requirements for that practice, 2,000 hours in 3 years or whatever each state has, that's a regulatory requirement. Because when we graduate, we sit for our boards and we're certified, we can go out and open up a practice and do whatever we want within our scope of practice and what the state's Nurse Practice Act dictates. So there are limitations on what we can do, but starting a business is not one. So as long as you have the requirements to start your business and you have that collaborative agreement with a physician for the first 2,000 hours in 3 years, you can go and start a practice. There is no oversight there's an impression, the visual is that they're like joined at our hip and we're tied to them in some way. That's not true at all. As a matter of fact, that piece of paper, that agreement sits in a desk drawer. It just fulfills a regulatory requirement. It's nothing to do with patient safety, nothing.
Teamsters? Yeah. That's how the truck drivers operate too.
In the back? Hi.
So thank you for doing this. I think any clinician probably uses, but for nurse practitioners, that's fantastic because they're growing. So can you talk about how does the nurse practitioner, how you help them become part of the ecosystem? You mentioned value-based care.
Mm-hmm.
So within that model, right, you would have different physicians helping the whole person. Also from a nurse practitioner, I'm just going to speak on the customers, the individual side.
Yeah.
They know a nurse practitioner when they're like, oh, I went to see my doctor,
Mm-hmm.
but I saw a nurse practitioner. In your model, how do you get them in the ecosystem and change somewhat of when people get care? Because
Mm-hmm.
what we have 150 million people
Right.
who get care through an insurance company.
Mm-hmm.
So as a nurse practitioner, to building up your practice, to being part of a doctor network, can you talk about how you fit into that ecosystem and educate them on that?
Sure. So first of all, nurse practitioners collaborate with any healthcare provider that it's going to benefit the patient. So if I'm taking care of the patient and I detect a heart murmur and I'm concerned about that, I will refer them to cardiology. So we don't practice in a silo, we're isolated, but we do refer out to whomever's best to handle whatever's going on with that patient at that time. And every clinician practices in a collaborative manner. There's a team that works with the patients overall to provide care. So as the primary care nurse practitioner, we may have a team of, if they're diabetic, they might have a podiatrist that's part of the team. They might have a nutritionist that's part of the team. So we all work together and we talk and we communicate for the benefit of the patient. So we're independent providers, but we don't practice in a vacuum.
And so in that vein of being an independent provider, let's say you, being part of the Elevance or Anthem Network,
Mm-hmm.
right? They have a provider portal,
Mm-hmm. Yes.
using that very generically of all the physicians. How do they become part of that?
Yes.
And for a patient to perhaps go to a nurse practitioner first,
Mm-hmm.
then perhaps going to a doctor. So can you kind of talk about those dynamics?
Thank you. You brought up a really excellent point, because one of the problems with, I'll talk about the insurers first and then I'll talk about the credentialing, because I think that's what you're alluding to. The provider directories are not kept up to date. So as a beneficiary, you're going to go in and say, hey, there's 30 clinicians within this plan. That's great. But then really, when you start digging deeper, maybe 10 of those are actually in. There's 30, but only 10 belong there. So there's a false sense of security that a beneficiary might experience. Plus also they expect that if they see that their provider name on the list, they'll be able to see them, and that may not necessarily be true either. To get insurance reimbursement, we have to be credentialed, so there's an application process that we have to go through to fill out, which includes everything from our education and training, our certification, our licensures. You know, if there's any blemishes on our license, we have to have malpractice insurance. Everything that the physicians have to have, we have to have as well, and so do the PAs. But you apply to be credentialed with the insurance company. And then you have your contract with the insurance company. It outlines how you're going to get paid, how the claims are going to be submitted, and all that. So that process is exactly the same for an MP practice as well.
So how do you get patients to recognize a nurse practitioner practice and say, I want to be part of,
Right.
I'm going to pick nurse practitioner ABC? How do you educate people on the fact that that is a practice, like going to a doctor? Because I think that mentality,
Yes.
people see nurse practitioners as part of the doctor's office.
Right. Yeah, it's interesting because when I worked in the GI practice, and a lot of the patients were listed to see, you know, they wanted to see their own provider, which happened to be a physician. So of course, they can't get in for a period of time. The nurse practitioner has an opening, we'll put you in with her. So they come in and they see me, and the first thing I'm like, why can't I see Dr. So-and-so today? You know, No offense, but I want to see my physician. I'm like, fine, that's fine. But I said, you know what? I'm going to take care of you today, and I'm going to report back to him about what I do today. And that gives him a little bit of sense of security. But then I do my visit, which is a total different experience than seeing a physician, because we do the whole person care. And every single time, the patient will come back and before they leave and say, can I see you the next time? Because the experience was such. And I think that's when you experience care by an NP, you're hooked. And that's how the marketing and all that happens. But also the NP directory is that other way for us to market our NP practices, because patients can actually go there and find a nurse practitioner. And we're listing our specialties, so if somebody's diabetic educator or takes care of diabetes, if somebody like myself treats Hep C, that's on. Somebody may do psych mental health and take care of children and adolescents, and that's a rarity. So we can put our specialties in on the directory so that patients can actually identify who we are. But again, trying to apply for these credentialing to get onto the panels is something that we need to do. There's a lot of concern too, because with the managed care plans and the ACOs, you have to have the patient attributed to a physician. That's the law. And it's going to take an act of Congress to change that, so that's not going to happen anytime soon. So what a lot of the ACOs in particular are doing is they're assigning a physician liaison, but that nurse practitioners, everything goes in under that practice. Every bonus check comes back to that practice. It's just that physician figurehead for that requirement that they figured out. So thanks for asking that. Behind you.
Is there you mentioned doing a business acumen class for nurse practitioners, which is great to learn the language of business and to be able to engage with business, banking, financial people. But at the end of the day, the core competency of the nurse practitioner is healthcare. And in a lot of ways, sometimes the founder and visionary of the business is not the best business operator. And so is there, one, do you find that that's an option in your network as well, where maybe there's an interest in getting connected to like a co-founder or an operator, and that allows the nurse practitioner to focus on healthcare, which is their training, is their passion, and then essentially offload the business process to somebody else?
That is an option as well. One of the things that with our NPs we start right from the get-go is we have a business readiness tool that they complete. It's quite a few questions, and it ranks where they fall in readiness to start a practice. There are some people who should not be business owners. They just don't have that type of skill set, and I don't want to set people up to fail. So doing this readiness tool was really important for us in the get-go to make sure that we're going to help the right people be successful. The last thing we want is somebody to fail.
Yeah, I've met numerous people that are great in their business, but they're not good at business.
Right. Right.
Well, I would argue that maybe she is the co-founder ultimately, like with the digital platform that supports the financial aspect.
Well, one of the things we're trying to do, believe it or not, is create an NP ecosystem where we have the business education, we have the community support, we have the support networks. We're networking like now with the pharmacists. We'll network with social workers, nutritionists, trying to pull all those pieces together, but also have an ecosystem with EHRs that recognize the preventative care and the screening aspect of it, because Epic is great, but it's not great in the office and outpatient setting. There are a lot of EHRs now that are paying attention to that. One I know really well. And but that's what we need to do, and use technology. That's the other thing. So many NPs are scared of AI, but we're trying to teach them to embrace it, because it's a tool that can actually provide data from patients that can be handy, but it can also make them more efficient in documentation and getting their information down, which that translates to, I get my notes done more efficiently, I can do the patient care, get that data. It saves me time, but it also makes me more accessible so I can see more patients. So that's the ultimate goal of utilizing technology, to make us more efficient and to not be afraid of it.
Just on that data part, is there any way for you to track all those nurse practitioner notes? Because I understand that is very valuable, understanding doctor notes in respect to pharmaceuticals. Perhaps the NP notes would be another. I mean, my buddy is in this business and he's making a lot of money selling data. I don't know, can NPs use your platform to write notes or upload their notes?
So we have contracts or arrangements with different EHR companies, and we don't get into the nurse practitioners will provide them with best in class or thoroughbreds in our stable, like we like to say, but we don't influence their decision on what they pick. We tell them, survey the options, look at all that's out there, and, take the best option that's going to work best for you. Because everybody's practice is different. Nurse practitioner practice models vary significantly, so what works for one may not work for another. But we do have AI scribes, we have revenue cycle management, and all those pieces as well.
Thank you. Sorry for asking.
So we'll roll up to 10 o'clock, and we have time for one more question.
In the back.
I want to know, do nurse practitioners, I think you were talking about like the elderly, do they come into people's homes, like private practice or anything like that? And do they accept insurance, or is it trying to from the customer point of view? And also, do you guys work with like, advisors to help the nurses make sure that their finances are in order? Whether it be insurance brokers or financial advisors, help them with their growing their income?
That was a lot to unpack. So nurse practitioners, the joy of going to somebody's home, it's wonderful because it's a privilege to be invited to somebody's home to take care of them, first and foremost. And to know that nurses are the most trusted profession, that gives us a leg up when we do these practices. The other thing is what we're doing as well is the nurse practitioner may have RNs that they'll employ to go do the house visit, but that they can be connected via remote telehealth. So if there is something that comes up, they can communicate right directly with that nurse practitioner, so there's no lapse in care, not like, I'm seeing you, let me go back and report to her, and you might hear back in a week. That doesn't work. Technology is also very handy. Remote patient monitoring devices are wonderful, plus also chronic care management. We can get reimbursed for the care that we're providing in between the visits that you have with the provider, which is amazing too. So there's a lot of ways for that to happen. As far as the financials, again, we're trying to support the NPs to make good financial choices. We're trying to help them with mentorship to get them through that first year. So we're trying to do everything that we can to make sure that they build and sustain these practices, because that's what we need to change healthcare. And the last thing I wanted to focus on, there's an opportunity right now, the Rural Health Transformation Grants. Every single state got millions of dollars. Connecticut has $15 million to spend in the northwest corner and the northeast corner. So we're trying to be part of the process of changing healthcare and making it transformative. The problem is that some of the ideas are old and they may not actually serve the purpose that I think these grants were intended. Our goal is getting the directory populated so we can come in year 2 with all these practices and say, that model failed, let's try and see what the NPs can do to transform rural healthcare, because that's where we're going. We're going to see the patients. So stay tuned.
So quickly, how can we help you? Is it this time around?
I think the biggest thing is getting the word out that there's support. The other thing that I want to say is I'm actually writing a book about coding and billing that's generic, so it's going to be for physicians, nurse practitioners, and PAs. And we're actually changing the format of our BBA course to be more inclusive for PAs and physicians, because I've been getting asked, can we take the course? And we're like, absolutely, you can. And changing it to be more generic for business. So those are some of the things that we can help, just getting the word out about who we are and what we're doing. And thank you for 1 Million Cups for the support that we've had, because you can see the growth in the past 2 years.
I think when you first presented, you had something along 150 or so. So how many are now in your directory?
So our directory is up to 600 and our membership is at 300. But again, we're transitioning those 800 over to our platform. With the education from the support from Washington State University. That'll be 180 new members that'll be coming and joining us. So getting those students is really going to be helpful. And of course, the conversations I'm going to have with the other education program and their endowment hopefully will replicate that same process for them. So again, that will be sustainable for us as well. So thank you so much.
Thank you very much.
Appreciate it.
To add to your collection.
Thank you.
I'm a little,
I appreciate
thanks
that.
again for a wonderful presentation.
Thank you.